Good morning, friends. It is October 3rd, or the second day of the federal government shutdown. We have a lot to cover today, so I'm going to get right into stuff happening in Wisconsin, and then we'll move to the federal level. Some of you may have seen this article. Survival Coalition did a last week to really talk about, kind of the full picture of all of the things that are happening right now that are impacting people with disabilities. And this was an article that came out of that press conference in the Milwaukee Journal Sentinel that I thought did a really nice job of focusing on the people with disabilities who were talking at the press conference about, kind of the full picture of what's happening here. When we started these webinars in January, yes, we're 10 months in, I think we started knowing that there was likely to be some pretty significant cuts to Medicaid. And as the spring went on and we have kept moving through the year, we've added more and more things that are pretty important to people with disabilities that are changing. So I think this article does a really good job of kind of showing the full picture, because people with disabilities and low-income adults and other populations who rely on multiple federal programs, food assistance, health, Medicaid for healthcare, housing assistance, education, and the enforcement of laws that are protecting, specific populations, because the world is not fair, have kind of been describing a kind of growing weight as all of these things are happening at once. And I think this is a good article that really paints that picture. I've seen a lot of folks sharing it on social media, encourage you to do so as well. And I think it's an example of when you do reach out to the press, you can really get your story reflected by them. So we're going to spend some time this morning talking about food assistance, because some of the changes that were passed in the July 4th reconciliation bill, which I will refer to as HR 1 for the rest of the presentation, are starting to kick in now. And we're going to talk a little bit about some of the deep nerd stuff of what's happening as those changes are starting to ramp up. Food assistance is really important to people with disabilities and older adults. And this graphic is from our Department of Health Services data dashboard on food share. So you can see why we're talking about it. Almost half of the people who are receiving food assistance are people who are either elderly, blind, or disabled. And a good portion of those folks are also in Medicaid. And you can see that a lot of times the amount of money people get to help them buy food is not it's not a ton of money, but it can be really important. It can be that the difference between, them being able to make it through the month and not. And certainly for a lot of low-income older adults and people with disabilities, many of them are on fixed incomes. I think about 25% of our older adult population is trying to make it just on Social Security income alone. I might be slightly wrong on that, so don't quote me, but it's a pretty high proportion that's trying to get by on a pretty low fixed income. And that is also true for people with disabilities, especially people who really need long-term care support through, say, a program like Family Care or IRIS, because there are income and asset limits to get into that program. So you really have people who need to stay below a certain income in order to keep access to long-term care supports that they need. And when you're on a fixed income and all of the costs around you are rising, that means that it doesn't take a lot of increases in other spending categories of your life, like housing or food, before your limited budget is not enough to meet your needs. So when it HR1 made a number of changes to SNAP, and some of them are starting to come to a head now. You may remember that SNAP has work requirements already. I call them prove your working or exempt requirements because I think that more accurately describes what they are. But the HR1 changed those work requirements and made more people have to do them. So the changes that were made increased the age span of who has to prove that they are working. It raises it from 18 up to age 65, which is I think about 10 years longer than the current requirements. And there are some groups that were exempt in the past that are no longer exempt, including homeless people and people aging out of foster care. The other big change is there used to be whole areas that were exempt from work requirements because those areas had low numbers of jobs, and those the bill changed the threshold by which you could exempt a whole geographical area. So all told, those changes that were passed in HR1, DHS is estimating means that almost 44,000 more people will have to prove that they are working. And that is in addition to all of the normal work that goes on with SNAP right now. In Wisconsin, we have, county workers who are really trying to help people, figure out what benefit programs they qualify for, and are doing all of the administrative work to help people apply and verify that they're eligible and kind of tick all the boxes and since SNAP already has work requirements, make sure that people who have proved they've worked enough are still eligible for SNAP. So we have about 700,000 people who are in SNAP right now across the state. And some of those people are subject to the work requirements that SNAP already has, and now more people will be. So it's adding on extra administrative work for counties, but we don't have necessarily an increase in worker or funding to do that yet. And I think in the coming months, there will be an opportunity for some state advocacy because our state legislators will need to consider, how is Wisconsin going to implement these new requirements from the federal level and provide the extra money that they haven't budgeted for in order to keep the program running. So I found this little graph, which was exciting to me, that kind of compares the different work requirements that were passed as part of HR1. You might remember that Medicaid does not currently have work requirements. These are the new as of HR1, and it gives you a good comparison of, what are the work requirements for SNAP and the forthcoming work requirements for Medicaid. You can see that they are different. And many people are in both programs. So states will need to implement both sets of changes to both Medicaid and SNAP. And there's a big advantage to trying to align, how similar can we make compliance for both of these work requirements the same, because we have so many people in both programs. So it's a useful comparison, and you can see that, who's exempt and all of the decisions about who falls into those exempt categories, they are different. And states are trying to think about, well, how do we make decisions when we do not have any guidance from the federal government on either SNAP or Medicaid? How do we make decisions so that people in both programs are not being held to different standards and have to do, have to do different things? So why am I saying that the changes that were passed in HR1 are coming to a head now? Well, the bill passed in July 4th, 2025, and there was not an implementation date for the SNAP Prove You're Working or Exempt requirements. And that means that effectively the new requirements went into effect the day the bill was signed into law, which is July 1st. And if you're keeping count, that's in the past. Generally, states have, generally the federal government gives states some amount of time when, a change happens and it's effective immediately to get itself ready to make those changes. But it matters a great deal about when they start counting the amount of time states have to make those changes. So September 4th, USDA sent a letter to states that said, we're going to give you 120 days, which is roughly 3 months, and they call it a hold harmless period, where we're not going to penalize you for not being in complete compliance with new requirements that we haven't told you how to implement yet. But they started counting that 120 days July 4th, which means that 120-day period actually ends November 1st. And as of November 1st, states will have to be implementing all of the requirements and changes to SNAP that are in HR1. And that means that county workers are going to have an increased workload because they're going to have to serve many more people, many of whom will not realize that they have to do something different than they did before to prove that they're working. And they likely will not have any more workers or money to do the extra work by that date. So it's starting to get real now. The other change that happened, if you're keeping track, October 1st was this Wednesday. HR1 said, as of October 1st, 2025, we're going to change what we consider an error. And we're going to count more things as errors than we counted before. An error rate is important because one of the other provisions of the bill is that if states have too many errors, above 6%, they're penalized. They have to pay a match for the program that they don't have to pay now. So states with error rates that are lower than 6% don't have to pay any extra state money to get the federal money for SNAP. But states that are above 6%, anywhere up error rates from 6 to 15%, have an increasing amount of state money that they have to put in order to draw down federal funding. And it's significant. SNAP is, $1 billion program. It a lot, and it's right now it's 100% federally funded. So if you have to states, if you have an error rate that's too high and all of a sudden you need to put in 5% of state funding in order to get federal dollars, or 10% or 15%, depending on your error rate, that's a pretty big amount of state money that you have to pony up in order to get federal assistance. So Wisconsin has a low error rate right now. It's about 4.4%. We would not have to pay a matching rate now. But remember, the what's considered an error has now changed. And the threshold for what's considered an error is now lower than it was as of October 1st. And the other piece is that all the changes to SNAP from HR1 are retroactively covered, which means that everything that would be considered an error from July 4th on is going to be counted, even though we haven't had any guidance from the federal government on how to implement these things, or communication with people who maybe weren't subject to work requirements before but are now. And starting, from this point forward, the error rates that we accumulate in the next 2 years are going to be what's used to calculate whether and how much money states will have to pay to get federal SNAP money. So, doing a good job and keeping error rates low is now really, really important for future budgets, because if you don't keep the error rate low enough, you could have a $200 million bill, that you weren't expecting, in order to keep, getting federal SNAP money. So some of these numbers may change a little bit. But DHS has done some amount of estimates about how much more staff and money do we need to be able to keep our error rates as low as they are now. Because remember, it's the county workers who are doing their due diligence to make sure that everybody who's in SNAP is qualified to be there and that they're meeting all of the requirements. And there is a consequence if we don't invest more now to help us keep our error rates low. Obviously, in a couple years, if our error rates aren't low enough, we could have an unexpected big bill. But the other piece is, if counties don't have enough staff or money to run the program, there are some real consequences for people who use the program. Many more people having to do more things does take more time for county workers. And there's only so much county workers can physically do in terms of the volume of work they're able to complete correctly without mistakes. So even if you are a person who may fall into one of those exempt categories for SNAP, if the volume of work increases for county workers and they don't have enough bodies to actually complete the work correctly, you may run into mistakes where people who are eligible accidentally lose their benefits. Or it may mean that it's a slower process for people to kind of get through the door. And all of those things, especially if they're mistakes, can increase error rates. So, our county friends really, lots of times when we talk about administrative costs, that's kind of one of a set of words that people kind of tune out. But the reality is there's a volume of work to running these programs correctly. And for many of the people that I work with and you work with, who are experiencing and have to do the paperwork and do the application, how much time it takes you right now to get through the door and be able to get, to get what you need. And if there's more people trying to get through the same door, somebody's going to have to go single file. It's going to be slower. Other important dates for SNAP, as of January 1st, so this is still in the future, another provision of HR1 reduces the amount of federal money that is provided to states to actually run the program, those administrative costs. So in addition to we're counting the error rates differently than we did, and we've changed some requirements that are going to mean more work more for the same number of workers. We're also at the same time reducing the amount of federal money that is provided to the state to run the program. Right now, the federal government reimburses 75% of the cost of running the program. As of January 1st, 2026, that drops to 50%. And then the following year, January 1st, 2027, it drops again down to 25%. So in other words, the state gets 75% of the administrative costs to run the program paid for now. And in 2 years, that will be reversed, where the state has to pay 75% and the federal government is only paying 25%. So that is, again, another unanticipated increase in cost because the amount of money it currently costs to run the program, it is what it is. And you're just changing who's paying for that cost and making it so that the state has to pay a greater proportion of that fixed cost that we have now. So there are some national articles about, counties raising the alarm and saying, hey, we do a lot of work on these programs, and there hasn't been a lot of thought here about how do states kind of make this very quick change. And I put this article in here because we have one of our county friends from Wisconsin quoted in it. And she's making the point that the actual work on the ground that is done by real people at the local level hasn't been thought about when it comes to making these changes. And unfortunately, it will be left to states to figure it out and figure out how do you fill those budget holes because you're getting either less support from you're getting less support from the federal government for your current costs, and they're adding more work, which are going to increase the costs at the same time. So I'm not going to go through this line by line, but the department did by county kind of break out who how many people in each county are receiving SNAP and what is the proportion of the county's population that is depending on SNAP. And I think there's some real surprises here, that there are a lot of rural counties, especially, where there are many more people than you would think, and it's a much higher proportion of the population who's really depending on these SNAP benefits as a way to supplement the funding they have for food. So all of the counties are in here, and then they also have broken out some of the tribal communities as well. And you can look for your own county and see how many people the county right now is working with who are in SNAP. A little bit of an update. We have talked over the last several weeks, and it has been a theme with this current administration, that many pieces of funding and programs that are funded by the federal government, the administration is not necessarily following what Congress has said in terms of here's how to spend that money. The other thing that has happened is that the administration has sometimes chosen to take back money that was previously appropriated, and there are a couple of federal U.S. Department of Education grants that over the last month, they were they were 5-year grants that were first awarded in 2023 and were supposed to go to 2028. And the Department of Public Instruction received a letter saying that the federal government was going to cancel that funding. One of those grants was for deaf-blind students. And last week I had said that the Department of Public Instruction had, asked the federal government to reconsider their decision. Well, we have some clarity that at least for the deaf-blind grant, the U.S. Department of Education has reconsidered, and the answer is still no. So this grant has absolutely been rescinded. There's a separate grant that really focuses on trying to grow and retain special educators. Again, it was also a 5-year grant that's in the same boat where the U.S. Department of Education wants to cancel the grant. That's a much larger grant. It's about $10 million. And they have gone through the same process where they've asked the federal government to reconsider. As of Wednesday, they have not received a response to that request. So we'll keep an eye on that for you. But there's no deadline also to which the U.S. Department of Education has to respond to the request. And of course, now we are in a government shutdown where many of the people at the Department of Education and elsewhere are being actively furloughed. So, when I say that the states haven't received guidance, say for the SNAP work requirements, many of the normal things that would be happening in the change of federal fiscal year aren't being released. That includes like jobs data and normal reports, and also, decisions like grant awards and other things. The staff that do that stuff are not being paid to work often because they're not considered essential workers. So sometimes when you have a government shutdown, it actually delays the response to states that the federal government provides. Moving to Congress. So we're moving here. So the government is shut down. That happened officially Wednesday, and we'll talk a little bit about it. The U.S. Senate, the U.S. House passed essentially a continuing resolution that would keep the level of funding the same through November 21st. So we're talking about a 7-week period here. However, that continuing resolution did not put any guardrails or limits about or include language in it about how the administration is stopping or freezing or impounding funding, which has been a complaint that the Democratic Party has had since March. And it also, does not reflect necessarily the bipartisan budget, agreements that have been made about the 2026 budget in those 12 appropriation bills. It's essentially a hold steady bill. There have been a number of Democrats that have said, hey, we don't know if we can trust your promises to fund certain things because since March, the administration has not necessarily funded what Congress has appropriated. And that has been really the crux of the conflict, although most of what you may be hearing about in the mainstream media is focused on the Democrats wanting to repeal some of the Medicaid cuts and that were included in H.R. 1 and more prominently extend the expiring Affordable Care Act subsidies. But really the baseline conflict, I think, is about how can we negotiate a 2026 budget with you when we thought we had passed a budget that reflected input from both sides, and then the administration hasn't necessarily followed it. So the House passed the continuing resolution and is not in until next week. So that has meant that if you want to keep the government open, really the only path is to agree to what the House already passed. And the Senate, the US Senate has held multiple votes and will continue to have multiple votes on just the House resolution. And those votes have failed. They have also held, the Democrats have their own proposal, which includes, language to extend the expiring Affordable Care Act marketplace subsidies, and repeal cuts. They've held votes on that proposal as well, and it has also failed. You need 60 votes in the Senate in order to pass the continuing resolution, and neither of those proposals had 60 votes. And so the government shutdown will continue until both the Senate and the House agree on the same language. And strategically, the House is out until next week. So it becomes, agreeing to the House's language becomes the pathway that's the easiest for reopening the government. Today, we anticipate that there will be another vote again on the House passed continuing resolution. And in the middle of all of this, the Office of Management and Budget Director has said, well, this shutdown won't be like other shutdowns. If the government shuts down, that means we get extra authority to figure out how we want to spend funding, and we're going to use that authority to, do reductions in force, which essentially means permanent firing of federal workers as opposed to furloughing and then those workers getting back pay. And we may choose to cut different programs and different things. So that was a threat that the administration has made. Yesterday, they did cancel a large amount of grants that, again, had been awarded to certain states for infrastructure projects. They have not done mass firings yet. But there are some indications that small independent agencies may be a target. This is all like very much not how a normal shutdown works. It's also very in keeping with the behavior that we have really seen since March, where the administration is kind of making decisions about money that Congress has said we want to spend it in this way and changing how it's spent. So it's, in that sense, it's not really a departure from some of the behavior that we've seen since March of this year, but it certainly is also not how shutdowns normally work. So this is just a useful graph to kind of show you what proportion of different federal agencies, what proportion of their staff are no longer working right now. And you'll notice that we spend a lot of time on the Department of Health and Human Services and Education, a good portion of their remaining workforce. And remember, many of these agencies have had significant reductions in workers through DOGE in the earlier part of the spring, have just a lot less staff right now than they would because of the shutdown. I don't want to belabor the shutdown. There are still things, the federal government has kind of essential workers like air traffic controllers that are reporting to work without pay. The Postal Service is still going to deliver mail. Social Security and Medicare will still send payments. Medicaid shouldn't be affected if provided the shutdown doesn't last for a full quarter. But there's certainly things that as the shutdown continues, people may notice more and more. Generally, the longer the government shuts down, the more impact people start to see the longer it goes. So we are in day two. If we were in a week out or 2 weeks out, that's when you really start to see a significant difference, because you're starting to have an entire pay period where people aren't going to get their paychecks and other kind of real world consequences. But for those of you who are using Social Security, your payments are going to continue. There may be a disruption in some services. And again, the longer the time is, the more people might be trying to access those services. So there's a few articles here, and you can learn what typically has happened in shutdowns in the past. Again, I think we are in a kind of new era where there may be some things that haven't happened in the past that do this time. So there are some questions you can ask Congress. Some of these are, familiar. This is really about the crux of the issue. The crux of the conflict is the budget that Congress passes going to be the promise that is made to states and to people who rely on federal programs? And are you going to follow the president's budget? Another version of that question is, hey, we all pay taxes into the federal government, and that money comes back to us in the form of federal assistance and programs. So, at some point, not being able to guarantee that what Congress is passing in its budget is going to come back to our taxpayers in the state becomes a real question. Most of the conversation about the shutdown has really been about this ongoing issue of the subsidies that keep premiums in the marketplace for Affordable Care Act marketplace plans are going to expire as of December 31st, 2025. HR 1 did nothing to extend these subsidies. So a lot of the conversation right now with the shutdown is pointing that out, that you are going to start to have people who are going to get notices from their insurance company that their premiums for next year's marketplace plans starting November 1st, that's the open enrollment period, are going to be way up. And people will have to make decisions about what plan they are taking. Maybe they take a lower cost plan that has higher out-of-pocket costs or covers less, or maybe they go uninsured. So there really is a time frame here of, Congress has to kind of do something sooner rather than later if they're serious about extending these subsidies, because people are going to start to have to make decisions in that open enrollment period about what plans they're going to take. It isn't clear, although there's a lot of discussion about extending subsidies, and there are Republican members who do seem to want to extend the subsidies at least temporarily, because they kind of realize it is something voters are starting to pay attention to and will notice. There are a lot of congressional members who are not sure that they want to extend the subsidies at all. And you may be hearing some messaging about, well, those subsidies are just, supplements to insurance companies and other things. There is a group of Senate Republicans working on a proposal for later, whenever later is, this year on the subsidies, but it likely will also include some changes on who can get the tax credits and how much those credits are worth, if they do that at all. And there's certainly a movement amongst some of the more conservative interest groups to not extend the subsidies at all. So you may remember us talking about this particular think tank in the past. This group had a lot of the ideas that became the Medicaid cuts that were included in HR 1. And they have a argument that we shouldn't extend the subsidies. And there are other conservative groups that have a lot of influence that are saying similar things. So we have to stay tuned. Remember, the um, House passed continuing resolution doesn't do anything about the subsidies. And Republican members of Congress have been saying for some time that they don't want to do anything in the regular budget process on the subsidies, that they want to pass separate legislation on it. And there's some rumblings of that there might be legislation in the works, but nothing that is, ready to hit prime time and on a route to pass. And again, the longer they delay, the more likely it is that people will get a notice about what their premiums are going to be and have to start making decisions. There's also a separate congressional bill that's been getting some amount of attention, and it's important to know that this bill exists. I don't think it's going to pass. However, national disability advocates are trying to really elevate its existence because they see it as a way that Congress could potentially be directing billions of dollars more towards institutions as opposed to home and community-based care. This is really focused on institutes for mental disease, and there are currently some limits that kind of set how much states can put money into those institutions right now. This bill would liberalize that a little bit and let states put a lot more money into those institutions. And when I say a lot more money, like $31 billion more over the next 10 years, so not an insignificant amount. Interestingly, when this policy was changed, there have been some test sites sort of with states. That's what demonstration projects mean. That allow, and again, these are all Medicaid dollars that would be pushed into institutional settings, which means if you're putting more Medicaid dollars there, likely you have fewer Medicaid dollars to put elsewhere. That it didn't have the outcomes that the bill says it wants to accomplish. We do have an issue where there aren't enough community mental health services available for people. And that does mean, and that's especially true for people with intellectual and developmental disabilities, that does mean that people are going to places like emergency rooms that aren't really going to meet their needs. But just putting more Medicaid dollars in institutions, the test sites didn't find that actually reduced the amount of use in ERs or improve any access to psychiatric hospital services. So there were about 60 disability groups that signed a letter and that kind of highlighted, hey, we think this bill is not a good idea for all of these reasons, and that it might actually do more harm than good. Like it won't achieve the outcomes that you're trying to achieve. This bill is also, in the context of the changes that HR 1, we have almost 1 trillion of Medicaid cuts that are going to occur because of HR 1. So, allowing states to spend even more money in institutional services kind of ramps up the potential impact on what does that mean for investment in optional home and community-based services. So if you wanted to elevate that concern with Congress, here's a potential question for you. And again, we're orienting the question of how are you going to, meet the needs of people in the community and invest in the community services as opposed to going back to old models that we know didn't work very well. This is just kind of our normal stock slides on important parts of the implementation points in HR 1. So I'm going to skip through those. That's just for your information. Moving to the administration, a couple of weeks ago, we had a press conference with President Trump and the Department of Health and Human Services Secretary and the FDA and CMS Administrator, talking specifically about autism. We covered it extensively last week, not only the language used to describe people with autism, but some of the statements that were made that were scientifically untrue. The president stated that acetaminophen is a use during pregnancy as a cause for autism. That is not true. And there was again an assertion that vaccines could be connected to autism. That is not true. And also a reference to a specific drug, leucovorin, that may offer some help to certain people with autism, but again, is not proven to be overall useful to the very diverse group population of autistic people. And if you put in a Google search, most of the coverage has really been about refuting those claims, those scientific, that the science is not correct. But I think one of the things that we've been hearing from folks kind of out in the community is sometimes all of the studies and all of the science isn't very compelling. And, certainly people, certainly that press conference has had an impact in the sense that people have heard those things and are now starting to make very different health choices and question their prior choices after that press conference. And it shows you the power of the bully pulpit and messaging. And I think that it's important to remember that, people are in a moment where we don't have necessarily a shared sense of facts. And it's very confusing for people to be able to sift and winnow all of the information that's coming from them from everywhere. And they ultimately want to do things that are going to make their child's life easier. So we had some conversations this week, and I think that, it's fine to post all of the science articles, and I haven't included them here because there's just so many of them. But I think it's important also to remember that, somebody who is questioning and fearful and trying to make their best decisions for their kids in a world where disability is not necessarily perceived as desirable, that we just have to meet people where they are as well. And it is also true that lots of people, may not have a doctor that they have an actual relationship with. Our systems have been put in place where, maybe you get access to a doctor, maybe you're seeing the same person over and over again, maybe not, maybe it's 15 minutes. That's really hard to establish trust. And some of the parents that we've been talking to have described, they have gone through different phases because they may not have expected having a child with a disability. And there is a process that parents learn over time. And I just think that the message right now is that, some of you who have had the experience of, learning as you go and have had experience that has been helpful, you are actually a very good resource for new parents who are hearing at all sorts of new information that is scary and trying to make the best decisions that they can. We certainly have also heard that, folks are trying different things. This is a moment where you, people are trying different sorts of supplements and other things, and it's not coming from a place of it's coming from a place of trying to help the person that they care about. And I think we have to be aware that, there are definitely businesses that are trying to take advantage of that hope and that fear, and trying to, convince parents that if you do this thing, then these outcomes will happen. That's always been true. And I feel like, this is a moment where parents who have already gone through those experiences can be extremely helpful to the folks that are coming up behind them. Yet another article, I think this is noteworthy for two reasons. This is not necessarily new news. We've talked over the last several months that the existing research that the National Institutes of Health has been doing on causes to autism, some of that has been canceled, and there's this new idea of putting $50 million into projects that are looking for the cause of autism that are not necessarily continuing previous research. And we've talked a little bit about some of the proposals may, in fact, be using AI or other analysis of broad claims or data sharing to do some of that. This is the first time I've seen the coverage also talk about improving outcomes for autistic individuals, and that could be a reflection of some of the feedback that happened after the autism press conference, which a lot of people, pointed out that the emphasis of a lot of the autism research has really been focused on prevention, which for a lot of people who hear that may feel like that there's a population of people that we are seeking to not have exist. So there's a little bit of change in language here, and also a little more change in actual autism researchers saying, we've looked at a lot of causes. It is complex, but we also think that there's maybe a need to shift spending to talk about additional treatments or interventions or ways to support autistic people to live fuller and more integrated lives. So if you have not heard of the Vaccine Injury Compensation Fund, you can be forgiven. This is a small part of federal government that has just kind of whirred along under the surface. And I didn't know a ton about it until there was an article probably a couple of months ago, which was talking about how important it actually is. So to set the stage, in the early 80s, there were a lot of lawsuits against vaccines because parents were asserting that they felt like a vaccine caused injury after it had been given. And it's important to remember that even when you win a court case, there are lots of costs that go into defending that case. So, somebody can say, I think this vaccine caused this specific injury, and they can maybe sue for that. That doesn't mean that they can prove that that occurred or that it did occur. And it may be that the courts will say, we don't think that the injury you're talking about is actually like the vaccine is the cause for that. But nevertheless, it is expensive for a vaccine manufacturer to defend that case and win that case, even though it maybe doesn't have, scientific merit. Um, and that was happening a lot in the early 80s, that there were many, many lawsuits where people were making claims that weren't necessarily true, but cost a lot of money to defend. And Congress said, hey, wait a minute, there are all of these cases that cost a lot of money to defend that aren't necessarily, being found by the courts to be valid, are creating a real problem for vaccine manufacturers. That it's costing so much for them to defend against litigation that the value of producing vaccines, if I can be subject to being sued for, the delivery of a vaccine, is going to mean that companies won't want to make vaccines. So in 1986, this body was created, and really for those two reasons. It was trying to provide a very quick way for people who did experience legitimate rare reactions to vaccines to file a compensation claim. And it was also established to protect the ability for companies to continue to make vaccines. Vaccines aren't really that profitable, and all of the litigation in the early 80s was causing companies to say, is it worth it for us to take on this liability risk and keep getting sued? Even if these suits never result in payouts, it costs us money to defend, and maybe it's not worth us making vaccines if it's going to cost us money to defend. And Congress saw that as a real problem, that if you didn't have companies that were willing to make vaccines because they were worried about getting sued, that you wouldn't have an adequate vaccine supply. So autism is not on the list of conditions that the Vaccine Injury Compensation Fund compensates for. And it is because that has already been litigated. In the late 90s and early 2000s, there was that one study that was then retracted that tried to link vaccine delivery with causes of autism. And we have spent a lot of money since then researching that link and finding that there isn't one. But because of that initial report, in the late 90s and 2000s, there were lots of claims that were delivered to the Vaccine Injury Compensation Fund that vaccines caused autism because of that one study. So the courts actually considered thousands of cases. And after many, many years of hearings and expert testimonies, the courts clearly have ruled that vaccines don't cause autism, which matches the existing science and decades of research. So autism is not on the list of conditions that this fund will award money to, because there isn't a scientific link, and the courts have ruled on many thousands of cases and essentially come to that same conclusion. So why are we talking about this? Secretary Kennedy does want to add autism into the list of conditions that this vaccine compensation fund will pay for, and as well as a couple other conditions, which many experts are worried would mean it would open the floodgate to lots and lots of claims and maybe bankrupt the entire fund. It's important to kind of understand that there is a group of folks that really do not believe that vaccines are a good thing, that they feel like vaccines are a danger, or that are ultimately, like, there's a movement that overall would like to see as few people get vaccines as possible. So in this case, autism the link to autism and vaccines, which has been disproven scientifically and ruled as not connected by the courts, is being used potentially for an additional purpose, as a way to essentially, advance vaccine, the goal of having many fewer people have vaccines, and intentionally maybe make it again less worthwhile for companies to produce vaccines. Now, this is an idea, but it's being set in public, and there was, it is actually part of a policy strategy that may be advancing some very, some overall goals with regard to having a lower rate of vaccination. The Department of Health and Human Services at this point would need to draft a rule. There would need to be public comment, but the fact that it has been discussed in public, and that it has been a policy and a mechanism that experts have identified as a way to perhaps advance goals that would lead to less vaccination is important. And again, using autism as a vehicle to accomplish a secondary goal. The president has again discussed tariffs and applied tariffs to drugs. This was announced on social media. On October 2nd, it was announced the tariffs would be delayed, but we keep having this discussion kind of in the public sphere about how we're applying tariffs to certain kinds of drugs. And it's important in the sense that, again, if you have increasing drug prices, one of the major things that Medicaid pays for are prescription drugs. Prescription drugs, by the way, are also on the optional list of Medicaid services. So, things that increase drug prices can cause really big unanticipated costs in state Medicaid budgets. And that's the reason that we're paying attention to, what is it that you are suggesting, and if it leads to higher costs for certain drugs, that could have an impact on Medicaid budgets. This week there was also an announcement, and again it is unclear about a deal with a specific drug manufacturing company, Pfizer, and there's a kind of reference to perhaps more companies that the president wants to make a deal with to sell certain drugs at a certain rate to Medicaid that he says will lower drug prices. It's unclear about what that actually would result in, if that would lower Medicaid budgets or not. In fact, we won't know, because the negotiation for drug prices is something that states do with the drug companies. So it's not a very transparent process. And I think the main point here is that we're infusing confusion into what drug prices will cost, and tariffs and also these other arrangements are really creating a sense of we don't know exactly what this will mean for people who are in Medicaid, and whether states will end up with a bigger or lower cost for their Medicaid budgets. Moving on to housing, in the spring, in May, the president's budget had some pretty significant proposals to reduce spending at the Housing and Urban Development for housing vouchers. Now, the president's budget is kind of a plan that Congress takes into account, but just because it's in the president's budget doesn't mean Congress agrees. Still, it's kind of a green light to here are the things that I think I want to spend more money on, and here are the things that I want to spend less money on. And it was fairly clear that this administration was um, looking at housing vouchers as being a place that they could want to spend less money on. Now, obviously, the budget process, you know, all of the bipartisan work on those 12 appropriation bills hasn't moved forward yet. We have a continuing resolution, but you can make changes to policy that are pretty important through other methods, including administrative rules. So this article is looking at drafts that these haven't been proposed yet of two administrative rules that would directly impact housing. So again, the first rule is really focused on how allowing housing entities to implement full-time work requirements for people who are using housing vouchers, and also limiting the amount of time that people can live in federally supported housing. And there's been some analysis that that could really mean a lot of people lose their housing assistance. Most of the people who are receiving housing assistance are older people or disabled or children. And 4 million people losing their housing assistance is a lot, because there's only about 8 million people who are in housing assistance right now. There's a second administrative rule that's drafted that is really focusing on the composition of households and trying to determine whether or not everybody is a citizen or a legal resident of the United States. And if there's one person in the household that isn't, that would mean that they wouldn't be able to get housing assistance. Now, that would actually mean that people would have to prove either their citizenship or that they're here legally, which has a cost. It is estimated about 100 million in new costs would be required to implement that idea. And it also might result in housing units being left vacant because many people who have mixed status families might just choose not to participate in housing vouchers, or if you didn't have the documents to prove your status, you might drop out of the program. Housing vouchers are often prorated, so like part of the cost is covered by the government, and so there is a cost of, if you have people who leave the program who have only part of the cost covered, and then those folks are replaced by individuals that have more of their costs covered. It could mean that there's a lot more cost to the program. So, you know, both of these policies really look like they're designed to try and shrink the number of people who might be receiving housing assistance, and lower the supply of places that will accept housing vouchers. And just as a summary, like again, these draft rules, which haven't been proposed yet, are really an outgrowth of existing momentum that the federal government has done. You know, I referenced the president's budget. They propose a 43% cut to HUD. There is already data sharing agreements that we've talked about here as well, and you know, other policies that kind of look in alignment with where the policies of these draft proposed rules could be. Another rule that was recently put in place by the Biden administration, again, this administration is changing direction on that rule, and this is important for a lot of people with disabilities who have wheelchairs. If you travel, sometimes there is damage or other things that happen to wheelchairs in transit. And this rule was put in place to try and limit that. The U.S. Department of Transportation is saying, yes, there's a rule on the books, but it's not going to enforce it. Kind of an overall global article about the impact of the SNAP changes that we spent a lot of time talking about on the front end of this presentation. So if you're kind of looking to zoom out and go, okay, we have 700,000 people in SNAP in Wisconsin. What does this look like across the country? How much churn and how many people could lose their food assistance or have lower benefit amounts? This is more of a global article for you to share. And again, there continues to be work on how do states interpret certain parts of the requirements of HR 1 with Medicaid cuts. So under the bill, one of the things states can do is apply for a waiver to allow short-term hardship exemptions. In other words, exempt people temporarily from prove you're working or exempt requirements in order to get their and to be in Medicaid. But this article is pointing out, how many people could be exempt really depends on how the administration interprets the law, in addition to whether state officials apply. So, some of the language that you see in this column here, if you look through it, who is the decider on whether or not a hardship exemption applies? Sometimes it's the federal government, and wherever the federal government has discretion to say whether it applies or not, really does determine how many people could qualify for an exemption or how many people couldn't. So one more illustration of some of this language in HR 1 seems like it's logical, but when you start digging down into the decisions of, how do we determine, whether somebody has traveled for medical care, and how do you document that? It can get complex fast. Now, this article kind of shows you, depending on how those interpretations are made, it can really make a big difference in terms of who's subject to the prove you're working requirement, and that the federal government actually has a lot of discretion in determining how it calculates, the employment rate. So these little changes about, whether the federal government decides that they're going to look at a 12-month 12-month period to determine whether the employment rate is 8.5%, or if there is if at 8.5% for any month of that 12-month period has a huge difference in terms of who will qualify for a hardship exemption. And the article kind of shows you the difference between those two things that sound very similar, but actually have very different results. North Carolina, again, states can apply for waivers to test out how using Medicaid money in a certain way helps out health outcomes. All of our programs like Badger Care is a waiver, Family Care is a waiver, Iris's waivers, Children's Long-Term Support is a waiver. But there are other ways, like states can create all sorts of different kinds of Medicaid waivers to test how do we spend money in Medicaid to create better health outcomes. So North Carolina had a waiver that was spending money on Medicaid on nutritious food and housing stuff and transportation to doctor's visits, and under the theory that doing those things actually would help improve overall health and avoid more costly health interventions. By all means, this program was popular, it was bipartisan, and it looked like it was saving some money. because oftentimes when you're doing these tests, you're trying to figure out, does it save money? And you're trying to put in some metrics to figure that out. But this is again a optional program that did some good work that is a casualty of the cuts to Medicaid and HR1. So North Carolina is going to stop this program because they are, you know, it is an optional thing they don't have to do. And even though it saves money, ultimately they're making a decision that not spending any money on this in terms of a bottom line budget is a bigger, that's what they need to do to avoid costs. This article is from California. I think it does a good job of talking about, again, all of the different touch points of how these different federal programs are impacting a family, kind of the web of things that they have collected to help manage and make it work. So it's a good article in the sense that I think it matches a lot of the experiences that people across the country have. And it's a good read because this is a family who's really thinking about like what happens if if there is a change over here or in both places, what will that actually mean for our lives? Connecticut is again thinking about how to, its Medicaid budget is going up before all of these cuts are coming. So this is another state that is now at the point where they have to decide, are we going to increase our cost to continue of what we're doing now, knowing that we are going to have some pretty big federal cuts coming at a later date. And then this last article is really talking about, all of the uncertainty when it comes to Medicaid cuts is impacting already the decisions that hospitals and nursing homes and community health centers are making when it comes to staffing and the services that they offer. And this has been a recurring theme. Like this is not necessarily new in the sense that we've talked about it before, but I do think that the new angle here is that they're actively saying this is going to depress the number of healthcare jobs that we are going to have, because in trying to budget and figure out how we absorb these large costs, we are going to make decisions that are going to impact how many people that we hire. And this article is also saying that some of the immigration policy changes that we are also seeing, the healthcare workforce is very dependent on foreign-born and new immigrant workers. So that is another, in addition to these large Medicaid cuts, the changes that are happening that may limit or discourage immigrants from wanting to come to this country are going to disproportionately impact this particular workforce, because so many people in the workforce are from the population of newly immigrant people. And I'm going to stop sharing now.
All right. So I think there were, still the questions of what is it going to look like for eligibility? If somebody has a disability determination, is that going to hold for SNAP and Medicaid? So some of those questions, which, again, we believe so, but again, we don't have all the facts yet. So I don't know if you have any thoughts on that.
Well, I mean, I think that SNAP already has existing work requirements, and the language, you go back to the slide that had like the comparison between the SNAP work requirements and the Medicaid work requirements. Disabled doesn't is not a word that you see in SNAP work requirements. I think it's medically, like the phrase is like medically
Medically
unable to,
fragile or,
yeah,
yeah,
medically
yeah,
unable to work, something like
yeah,
that.
yeah.
I may not have the language exactly right. Um, so, if you are like, and I'm making an assumption, if you are a person who is in SNAP now, who is exempt from work requirements, and they are using, a disability status um, to show that you are unable to work, like, I think that would probably continue, right? Like that is the way that people with disabilities are being exempted. And I'll just go back to the slide here till I got my language right. Medically certified as unable to work due to physical or mental limitations is the phrase in the SNAP work requirements. So I think that if you have an exemption now from those SNAP work
Mhm.
requirements, there is some way that you are proving that you meet that standard, and that probably will continue. I think the bigger issue for our population is, with so many more people who
Right.
need to do something different than they are now, unless you get um unless you get more workers to be able to handle that extra work, even the folks that are exempt, may have delays or harder
Right.
time getting through the door, so to speak, to make sure that are able to continue their benefits.
Well, and I think that that's kind of what I said about the unknown is that you may have to prove again because of the newness that it might not be where you're already exempt and it just flows. We don't really know because the state is still working on that. I think
Right. I mean, yeah.
right? I mean,
Yeah, and I do think that there is great concern amongst all of the Medicaid directors across the country that the SNAP and the Medicaid work requirements be as aligned as possible, but you have two separate federal agencies that are doing their own guidance on it. So you are identifying a real concern that that Medicaid directors have too, is it's like they know people are in both programs. So the easier it is for people in both programs to kind of prove, once, instead of having to do two systems, like that is what the goal is, right? That's what they would like to see, is to how can we make it as easy as possible, that if you know that you want those two things to be as aligned as possible, so that proving one kind of qualifies for the other.
the other question, which I thought was good, was what is the definition of institutional care? And through the question and answer, the person said, well, my daughter lives in a CBRF. And I explained, well, that's covered under home and community-based waivers. So when we're talking about this, bill that's talking about more money for institutions, it's more of our developmental disability centers, nursing homes, kind of this, so I thought that was a good question because sometimes people don't know. And even though that is a kind of group setting, it doesn't necessarily fall under what we might say is the definition of an institution. So just thought you could.
It's Yeah, institutions are actually are regulated, and
Mhm.
there's institutions for mental disease,
Right.
as well as state centers for developmental disabilities and nursing homes. And they all have slightly different regulations. Those are the three entities that are regulated as institutions. Now, interestingly, for everybody who is in family care or IRIS, you have to have a function. You when you do that functional screen, what they're measuring is whether or not you meet an institutional level of care, nursing home level of care. In other words, that what to get into the home and community-based services program, they're really measuring whether or not that if you didn't have these home and community-based services, would you be in one of these institutional settings, right? So there is a connection. And first, it's interesting because when I talk about institutions, I am thinking about those heavily regulated, very large congregate settings like nursing homes, like um, mental institutes for mental disease and the DD centers. Some
Yeah,
of our parents have noted that they think of institutional settings as being these smaller settings that we actually pay for
right,
in the home and community-based care systems like CBRFs and like AFHs.
right,
That they are kind of have the same similar characteristics, even though there are smaller numbers of people in them. So like that's an interesting evolution in the last 50 years, is like regulatorily, we think the institutions have a specific meaning, but practically many people and parents and people with disabilities see institutions as, these much smaller settings that are
right.
technically funded by home and community-based optional services.
Right, but when it comes from a funding perspective, they're not talking about putting more money in our home and community-based waivers.
No,
They're talking about the
they're
opposite. Yeah.
talking
So
about
I
the
think that's what
actual
I could
institution.
gather the
Yeah.
person was like, well, what am I at if I'm what's the ask? Is my child in a institution or not? And so that's why I
Ah,
thought it was important to clarify, because I think that's what I
yeah.
was getting from the back and forth we were having, maybe. Yeah. So I'm glad that person explained so we could answer that. But
Yeah.
that's it. I think that's it.
Okay.
All right.
Well, thank you for coming. We will have all of the information and materials out this afternoon. And I'm just going to scan through the questions. My goodness, we have a lot of people who did paragraphs. Sally, you've been doing a lot of work.